Now, many Nigerian women do not live to tell their child delivery stories. This is because every 10 minutes, a Nigerian woman dies from pregnancy and pregnancy-related complications, according to statistics and maternal and child mortality from the United Nations Children Emergency Fund, UNICEF. In this report, Nneka Ozadibe looks at this problem and how another African country is working to change this reality.
The journey to motherhood should be an enjoyable experience, but in many rural communities in Nigeria, it is filled with uncertainties. Women die from preventable and treatable complications that could arise in the course of pregnancy or delivery. A research carried out by UNICEF suggests that 144 women die from pregnancy and pregnancy-related complications every day, meaning that every 10 minutes, a Nigerian woman reaches her end. UNICEF also says that the woman's chance of dying from pregnancy and childbirth in Nigeria is 1 in 13. In 2015, an estimated 58,000 maternal deaths were recorded in Nigeria, accounting for 19% of the global figure that year. Put differently, at least 800 women die in every 100,000 live births, with the highest deaths occurring in Nigeria's northeast. These gloomy statistics highlight the need to urgently address challenges in Nigeria's health sector that predisposes pregnant women to untimely death. While global maternal mortality dropped by about 43% since 1990 till 2017, Nigeria still ranks highest among sub-Saharan African nations with high maternal deaths. The country is closely followed by Kenya with 540 per 100,000 live births in 2015, with Tanzania and Uganda also on the list. Perhaps this troubling information motivated inventors in Uganda to design a new technology that will help women in remote areas of the country have access to affordable scans and save lives. The device can be plugged into laptops and even smartphones, cutting down reliance on power supply.
As you may know, in most rural areas, electricity is just a luxury. So when we were posted there, other people were carrying out their jobs, and for us, our hands were tied. We could not use the knowledge that we're learning in school in the hospitals where we were posted. And then mothers kept dying of conditions that we knew could have been scanned on ultrasound and prevented.
This invention, Uganda, goes to show how concerted efforts from governments and private stakeholders can safeguard maternal health not only in Nigeria, but in Africa. Nneka Ozadibe, TVC News.
Now, joining us on phone is a medical doctor, Omadele Boyo. It's good to have you join us this morning, Omadele. Can you talk to us, basically, the child mortality or maternal mortality rate in Nigeria has really been very high. Why is it so challenging to handle this and reduce the rate?
Yes, thank you very much for having me on your program. Indeed, maternal mortality in Nigeria is high because of 5 things. 1, bleeding in pregnancy. And like was read earlier on in your program, maternal mortality is death in pregnancy. A woman who is pregnant and dies in the course of the pregnancy and after 42 days after delivery. This is called maternal mortality. And the commonest causes in Nigeria, like we all know, hemorrhage, that's bleeding in the process of delivery or in the process of pregnancy itself. Then infections, sepsis, and then unsafe abortions. You know, we have a lot of quacks and people that carry out termination of pregnancy in very abominable conditions. Then hypertensive disorders, in preeclampsia, eclampsia, that is hypertension in pregnancy, in eclampsia in some cases leading to feetings, like convulsions, and then obstructed liver. These are the common 5 things that cause maternal mortality in Nigeria.
All right.
Bleeding.
Okay. All right, Dr.
Yes.
Dr. Boyo, we have to leave it here now. Thank you very much for giving us those tips. We have to work with those and enlighten ourselves. Thank you so much.